I felt betrayed by every woman who had kids. I was worried about taking medication while I was breastfeeding. I realized if I died, that would be worse. I'm clearing things up today. Common misconceptions about childbirth and postpartum, things I wish I had known, and I'm a labor nurse. I thought I knew stuff. I'm digging deep. I'm getting into all of it. This is the first episode or the first video of my Survivor series. Stay tuned. It's going to be good. Hey, I am so glad you're here. Whether you found this video on accident, you were scrolling through, or things were playing, or you came across my channel and thought I was super funny, which I am, thank you so much for watching. I'm glad you're here. Either way, you need to hear this, so please keep listening. I am Mandy Irby. I am the birth nurse, and welcome back. If you have been here before, you know I believe that women's bodies are powerful, and with the right support, we are unstoppable. If you agree, consider subscribing, and thank you for the likes. And regardless of where you are in that birth continuum, there are some things that we need to just get clear. I am reading Penny Simpkins. I thought that was wrong. I am reading Penny Simpkins' When Survivors Give Birth book, and the link is down below. If you don't have it, you need to start reading it. It's amazing, especially if you are a birth pro. It should be on your bookshelf. It is a must read. It is very intense, however, and I am learning a lot personally and professionally, and I want to share that with you guys because I don't think a lot of people are talking about it, and I think it's a really, really big deal, especially in the Me Too movement. Right? So when I was pregnant with my first baby, I thought I knew things. I was terrified, however, and I thought that I could figure things out. I even took a childbirth class. I was excited to have a baby, but I didn't always want children. But at that time, we were ready and we were all in. I thought having a baby would be a dream. I had heard that having a child would be difficult, but it was not something I had ever done, or I really knew how to relate that difficult into anything that was in my life. It's not that I've had the easiest life, but I've never raised a human, so it was hard to conceptualize what that meant. Can you agree? Right? You've heard that it's hard, but you're not really sure what that's going to feel like. Well, I thought the good would outweigh the bad. And to be honest, for a very long time, it did not. The good did not outweigh the bad for me. So I've been wanting to talk about this for a really long time. And if you're in my Facebook group or getting my emails, you've probably heard some of this already. But I just listened to a podcast, and I'll link that down below, on NPR. A friend sent that to me, and I was super grateful because it put into words and it helped me get this into words, what I've been feeling. And it's nice to know that other people feel the same way and relate their birth very similarly. What a woman is going through after she gives birth is so much more than just about the baby. There is so much going on when she gets home. There is continued pain. Everyone plans for labor pain. I mean, I'm a childbirth educator. That's what I teach about, how to manage pain and labor and how to process that. But when you get home, after you've had a baby, you still have pain. They have pain in their breasts, regardless of if you're breastfeeding or not. Pain in your stomach. Your uterus is getting back down to size. Pain in your abdomen if you've had a cesarean. Aches and pains like I'd never felt before. From the work, from pregnancy, I don't know, from exhaustion, just my body hurt. My butt hurt. My perineum hurt. Everything hurt for a period of time, and that can last months depending on what is hurting. The partner changes, your relationship changes, you see your partner differently, you're exhausted. The fatigue cannot even be described as fatigue. It is just pure exhaustion. You might look at your body differently. You did something super incredible and you are Superwoman, you have amazing superhero strength, or you feel like your body failed you and you're disappointed in its efforts. Incontinence, bleeding, milk's coming out, hormone roller coaster ride. Your hormones are up and down. You're crying, you're happy, you have feelings you didn't expect. I had so many feelings I didn't anticipate and challenges I didn't expect to have. The hormone shifts, we know that it happens. Like I was super sweaty. I know a lot of friends wake up sweaty. They're just like their temperature's out of whack. Just hormones affect every part of your body, every big organ system. And so everything can be affected. Pooping, peeing, incontinence from either the trauma of childbirth or catheters, if you needed a catheter. Brain fuzziness, you can maybe not hold your thoughts together as well. There could be stress about money. There's family dynamic stress and pressure. There's pressure to lose weight and to look better. I just talked about this with my childbirth class. Like there's so much pressure to bounce back. You just had a human come out of your body. Like there's no bouncing back to when you never had a human who had come out of your body. Like, why do we want to go back there? We're never going to be back there. We've always had a human come out of our body. So now we have to reshape how we see our body. So that happens and that's normal. But it was unexpected how I just had to like process that loss. Oh, and I recently went to an all-day conference, and just the things that I've been reading from this book, learning through Lamaze, teaching my clients, learning for myself, it's all kind of coming together in this really crazy storm. I just have to get out and see, like, does this make any sense? Can anyone relate to this? Because it just seems wild to me. So here, see if you can relate to any of these. Or your friends who are having children or have had children, or if you're a birth professional, any of your patients have these. Trouble getting pregnant or wanting a baby for a very long time, unexpected outcomes during pregnancy or an unexpected pregnancy. Maybe you anticipated it to be one way, but it was actually different, especially if you have like health conditions, you're on bed rest, you're in the hospital for a period of time, or there's some scary situations going on in your pregnancy. You tried to get pregnant for a very long time, or you experienced infertility, multiple losses, or even one loss, a death in your life, in your past as a human, if you've had a loss, like a death, or a big move, or a big traumatic experience. Yeah, so many people can relate to that, I think. I think we all experience a lot of these things just by being human. History of a mental illness in your family or in your own past. If you've had a history of depression or anxiety, OCD, or your family has, or even a substance abuse, your family has a history or you have a history of substance abuse, medical problems that happened during your pregnancy or that you're experiencing, or anything unanticipated with the baby, not even during pregnancy, even during your birth, if the baby had to go get medications or had to go back into the hospital or had to go to the neonatal intensive care unit, if you had any unexpected procedures, if you've had any assault or trauma in your past. That is just naming a few of the reasons that would make you or a person at higher risk for postpartum. What's it called? MADs? Postpartum MADs? PMADs. So this list is just a few of the reasons why someone would be at higher risk for PMADs or perinatal mood and anxiety disorders, PMADs, perinatal mood and anxiety disorders. So it's all of those things lumped in. And then perinatal is all around pregnancy, postpartum. So it's just this umbrella term to cover everything underneath. So that's what I mean. Sometimes I just say postpartum depression, but that's not. I really mean PMADs. So PMADs. So that list is just a small part of what would make someone high risk for PMADs or a mood disorder surrounding their pregnancy and their childbearing time. So that's a lot of people. And I don't think I really realized that. Also, talking about PMADs, anxiety, depression, OCD, psychosis, baby blues does not make you have it or prevent you from getting it or experiencing it. It can come up anytime in the first year after having a baby, or about the first year. So you could have baby blues, which is that normal up and down hormones. You're exhausted. You have this new role. You have someone clinging to you all the time, like this little tiny thing that's sucking the life out of you and needs you and cries and wakes up the second you fall asleep. All these things. You're struggling to eat and drink and feed yourself and this other person. That's normal. That lasts about 2 weeks. That's baby blues. Then you're like, oh, I'm good. I learned about depression and, Mandy talked about that in her videos, but I think I'm good. 6 months later, all of a sudden you're not good. So that can happen. Crazy. I just don't think we're talking about it like reality really is. And I think people are so afraid of being that person that puts their kids in their car and drives into the lake. Have you seen that on the news? Or starts their car and sits in the garage with it running. That is not PMADs my majority. That is a very specific problem called postpartum psychosis. And what I told my students recently in my Lamaze class was the news is not here to teach us about PMADs. They are not here to teach us about mood and anxiety around pregnancy. They are here to teach us how to watch the news, right? They want an audience. They want subscribers, if you will. They want people to keep watching. So they make it dramatic. And they talk about this way on the end of the spectrum disorder that affects like 1 in 10,000 people, I think. Uh-oh. It's mostly connected with bipolar disorder. Not everyone who gets psychosis had bipolar, and not everyone who has bipolar disorder will have psychosis, but they're very closely linked. So I used to think of as a spectrum, like baby blues to psychosis, and I thought I was okay if I didn't have thoughts about hurting my baby. That's not the case. I was not okay, and I never had thoughts about hurting my baby. But I waited and waited, thinking I don't need to get help until I want to harm my baby. Because to me, that's psychotic. And that is like outside of the realm of reality. I don't really want to hurt my baby. So anything before that is just something I need to deal with, and something that actually shocked me. And I felt so betrayed, if I'm like speaking honestly and getting this off my chest. All of the women that came before me that had babies that I knew, all of my family, all of my friends, even my mother. Well, I knew she had suffered from depression, but I didn't really hear the ins and outs. Like, I felt betrayed by every woman who had kids. Now, that was depression talking. In my head, it talks very quietly and it's very sneaky. And it told me that, but I really felt that. I felt, why did they not tell me how horrible this was going to be? And then I thought, if everyone experienced it, someone would have told me. I have friends and family. A lot of people I know had babies. So then I thought, maybe I'm just alone. And they didn't experience it. And that perpetuated the loneliness even more. Can you hear how depression is a sneaky bitch? Like, it's scary how sneaky and smart depression sounds in my own head. That was scary. I don't know if other people can relate to this or if this was just me, but when I look back, I think, oh my gosh, that was depression. It's like your brain on drugs, but it's your brain on depression and anxiety. All the mood disorders, they have ways of talking to you because it's inside your brain, but it's a disease and it can be treated. So knowing that it can happen, it can be very sneaky, is very scary. And I think that people should just hear that. I think we should hear that in each other and hear that, I feel almost personally offended if I know someone who is suffering and they didn't tell me. But then I think, but I didn't tell anyone else either. I was sick. I was very sick. I hated my new role. I longed for my old life. I didn't like my kid a lot of the time. I didn't like my husband a lot of the time. And I definitely didn't like myself most of the time. I was surprised how low my self-confidence was about caring for a baby, even though I'm a nurse and I'm supposed to have these skills. I felt like I had no idea what I was doing. I felt like I was bad at everything, every part of motherhood and every part of parenting. So I think it's so funny when we see like life hacks, because everything's a life hack and no one knows what they're doing at all. So this is just the tip of that iceberg, and I cannot wait to give you more information, not just about me, really not really about me at all, but about you. Stay tuned, keep watching. If you learned something or you can relate, thank you for the thumbs up, and consider subscribing in the round picture of my face. And if you are hearing this and thinking of someone in your life, or you want someone to hear this as well, please share with them and share on your social media platforms. Cannot wait to see you soon. I'll see you next week. Bye.